If things go according to plan, the Barbados Revenue Authority will be in place by April the 1st, and workers from the agencies which will merge into that new entity will have some time to decide if they want to stay on. They've been told it is necessary that government moves to bring the staff together by that date. Workers were also informed that once the integration is done, they have 2 years in which to decide on their long-term employment with that new body. This was pointed out by Acting Permanent Secretary in the Special Projects Unit of the Ministry of Finance, Margaret Sivers, during a meeting on Monday to answer questions and allay any fears that workers may have about their employment with the new organization. Several other senior officials attended that meeting at the Lord Erskine Sandiford Centre. Ms. Sivers explained that most option forms had been given to the employees last week. She says senior public servants felt it was necessary to give the staff an opportunity to raise any issues and seek clarification about those letters and the implication of being seconded to the BRA. Healthcare tourism is a market the Caribbean can tap into, but to do so, it needs to offer world-class treatment and techniques that are competitively priced. Chief Executive Officer of Jackson Memorial International Hospital in the United States, Dr. Kester Ned, says while the region's healthcare providers may be trained to international standards, the cost is prohibitive. Speaking to key stakeholders in local healthcare at the Lord Erskine Sandiford Centre last evening, Dr. Ned said services in the region are not cohesive and this lends to high costs. He said that the JIPA network affordably offers patients with access to healthcare, critical medical services and elective procedures in several countries including the United States, the Bahamas, Barbados, Costa Rica and Panama.
We have the ability based on cost and quality to parse the care of patients appropriately. So a person with cancer could get a diagnostic workup done in the United States. They could get radiation done in another part of the world like Panama, and they could get the chemotherapy right here in Barbados. Why? Because you are able to purchase drugs at a very reasonable cost because of your buying power that you have by organizing a drug purchasing program. Okay, so we say, let's find the reasons why how we create centers of excellence is that you look for the areas where you have strength and you grow those areas.
Dr. Ned said JIPA's membership also offers collective bargaining for cash-paying patients.
If you have cash, the natural, you should get this for cheaper. That's just how industry works. In healthcare, it's the total opposite. If you have cash, they charge you more. So the clear issue is we have to use our collective advantage of organization to be able to achieve that.
Well, Minister of Tourism and International Transport Richard Seeley says there is still a need for significant investments in medical tourism to bring Barbados in line with key destinations across the globe. He says government is playing its part in encouraging investments and developing that sector.
I can assure you that with the other amendments that we're looking at for TDA, which will of course be coming on stream soon, when we completely rethink and restructure the whole question of concessions and incentives to the sector, that it will make us even more attractive for those investors who are interested in medical tourism, or for that matter, health and wellness tourism. But I wouldn't want the thought to, or I wouldn't want the point to go abroad that somehow there are all of these inhibitors to people who are interested in those projects, when nothing at all is, or that's not the case at all.
Mr. Seeley says Barbados is doing well in vitro fertilization and he would like to see that program expanded. Minister of Health John Boyce is dismissing the notion that cuts in healthcare funding will destabilize the system. While acknowledging that the reduction comes at a time when healthcare requires more, he says the money allotted needs to be carefully managed. The minister, in his presentation on day 4 of the estimates debate, revealed that Barbados healthcare offerings will be expanded in the coming months.
That is with the opening of the St. John Polyclinic. We have deliberately, and I say this again because we heard it about 2 or 3 times from the other side. We have deliberately taken funds from from other polyclinic institutions like the Glebe, St. Philip Polyclinic, and the like, to be able to have our startup situation, our startup finances for the St. John Polyclinic.
Well, while acknowledging that the Ministry of Health is challenging to manage, opposition Christchurch West MP Dr. Maria Agard queried why the Queen Elizabeth Hospital was out of vital drugs. She's also calling for Barbados to apply international rules to the application of health care.
Sanitation and sterilization, that is a cause for concern. And I just want to caution the minister that certainly we should be aiming to reduce any incidences of secondary infection as a result of the lapse of our sanitation and our sterilization.
Opposition MP Cynthia Ford is calling for the establishment of a special rehabilitation facility to treat young drug addicts. According to her, it would help to save the youngsters, especially those who end up with mental challenges as a result of illegal drug abuse.
They tell you that they were using marijuana from the time they were 7 and 8 years old. Or some of them tell you that their parents gave them in tea, and so on and so forth. And of course, a lot of Barbadians seem to be of the belief, and I don't know nor am I interested at this stage, but a lot of people seem to think that using it will help to correct the issue of asthma. And so it is fairly widely used in many, many households. And I believe that we are at this juncture in our society where we must have a properly designed facility to accommodate our young people who are addicted in a way that it is impacting not only on the families and, of course, the communities, but in the schools.
A St. Michael youth has been remanded to Her Majesty's Prison at Dodds on a charge of murder. He is 23-year-old Richard Shamario Worrell of Darriston Road, Grisettes. Worrell appeared in the District A Magistrate Court today to answer the charge of shooting 22-year-old Josiah Claremont of Orchid Drive, Husband, St. James. Claremont reportedly died after he was shot during the incident on February the 15th while at Fairfield, Blackrock, St. Michael. The police say Worrell was remanded until April the 27th. French, its people and culture, were celebrated as Barbados joined with French speakers across the globe to mark International Day of the Francophonie. We hear more now in this report from Kishmar St-Just.
There are over 200 million French speakers in the world. And even though French is not the official language of Barbados, the island was not left out of activities to mark the day. There's actually an entire week of activities being held for the first time in Barbados, celebrating the French culture.
We started on Monday by having a round table at the University of West Indies with my colleague Desrin Bogle. And so it basically was, the discussion was to have people interact about where is French language today in Barbados and what is the importance of French language in Barbados. This afternoon, to conclude the activity and the week of Francophonie, activities in the Combermere School with students once again being the main actors of the activities of the event. They will present, just like in Codrington, they will present their own work and their own research about French-speaking countries.
Barbados, like many other nations, is a potpourri of nationalities, culture and language. There's also a growing number of French speakers who call the island home.
I've been here for almost 9 years and I enjoy every minute of it. Of course, I like to go back to France, where I'm from, every summer, so that I keep up with the culture and with the news, and so that I can bring something back to Barbados. But I really feel that I belong here now.
And there are many ways to learn the language here. It is taught in various schools, at the University of the West Indies, the Barbados Community College, and the Alliance Française. Concerns have also been raised by UWI lecturer that many are not seeing the language as important.
With the proximity of Latin America, there is also the matter of Spanish being considered more important than French. So I think it's a matter of public awareness. Persons are not really as aware as they should be that French is actually more important on the international scene than Spanish. When we speak of Spanish in the Caribbean, there is the possibility of having partnerships, but at the end of the day, the average person isn't involved in these partnerships. So when it comes to job prospects, French would allow you to have more opportunities on the international scene.
Pour des nouvelles CBC, je suis Kishmar Saint-Gis. That means for CBC News, I am Kishmar Saint-Gis.
The Caribbean's fight for reparations has given new life to CARICOM. That assessment from Pan-Africanist David Kamashong as he addressed a town hall meeting on reparations at the Mount Tabor Primary School last evening. Mr. Kamashong says the issue has the full backing of CARICOM Chairman Dr. Ralph Gonzalez and Prime Minister Frendel Stewart, who heads CARICOM's subcommittee on the matter.
This Reparations Commission was playing a role in giving the Caribbean community something to get their teeth into, an issue that unified us all, and an issue that, you know, was getting all of the member states on board on a campaign that has tremendous potential to transform these CARICOM member countries.
Mr. Kamashong cautioned that reparations issue can only be settled with the full support and involvement of all Caribbean people. But he says the region must be on guard that the CARICOM Commission does not move too quickly. The value of the visual arts is underestimated in Barbadian society, the message from the organizers of the Caribbean Fine Arts Fair, which took place last week in Barbados. However, they're hoping more events like these will lead to change. A CBC team spoke to some of the artists and visitors who gave their impressions of the just concluded expo.
Sculptor and painter Arikan Southwell told us a mahogany piece requires 16 to 18-hour days to complete. The Virgin Island artist says one has to be dedicated.
Each individual pieces have its own personality. You see what I'm saying? For instance, this particular piece here, the other lady actually stayed there during the opening for at least 15 minutes.
Bajan master Carlton Morrell says he aims for his work to reflect the Caribbean and be appreciated internationally at the same time.
Every now and then, someone of your age group, they will rush to me and say, Mr. Morrell, I want to have that painting. And then I would say, well, what's your reason? Why are you so excited about it? You would know how much my mother would love this, or my grandpa will love this. And I can see the excitement on their face. And it may be a piece that it may actually reflect a portrait of an older woman, maybe fixing fish.
Long-standing visitor Derek Dunn says he fancies Caribbean art for its color and vibrancy.
I really like the art here, but you know, I love Barbados. I love the Caribbean. I've been here 6 years, you know. And there may be a group of several paintings from the artist, but there may only be one that really grabs your attention, you know. So I don't really know. I like these.
The exhibition ended Sunday, and organizers tell us they hope expos like these can alter the mindset of some people about the arts so it can prove its true worth. Sean Farrell, CBC News.